The new American Society of Plastic Surgeons statistics came out for 2023. And I always love going over these because it's showing us a general trend despite the economic failures that we have currently.
And remember, these are U.S. numbers. They're not worldwide numbers, number one. Number two, we did this last year on the podcast. So for those that you remember, you can kind of go back. And what we'll do is we'll compare this year to last year and give you guys an idea of what we think caused the differences.
All right, big drum roll. We've got top 5 procedures.
And the top one is always the same.
Yep.
Pretty much has always been the same. It's been the most common plastic surgery procedure forever, and it's liposuction.
Yep.
And it could be a little bit of liposuction or a lot. It can and it could be in conjunction with another operation or by itself. And liposuction will always be at the forefront of plastic surgery because removing unwanted fat is probably the biggest problem people have.
Sure.
So they all want to kind of target that problem.
I'm going to preface this entire conversation by my thought is that with the ever-growing social media network, that plastic surgery is just going to continue to be on the rise because it's just so much more in your face. We see it now. We see before and afters. We see before and after videos. We see more people in exotic places where they have their bikinis on and things like that. So I have a feeling that this is only going to continue to rise. And with liposuction, we see almost 350,000 procedures, up 7% from last year.
And the numbers themselves, if you really look at it, and again, what we're talking about is self-care, right? Surgical self-care, but we are. And if you look at the difference from 2023 to 2022, okay, 5% rise in plastic surgeries and a 7% rise in minimally invasive procedures compared to the year before. Now, the interesting part is, and I kind of just want to read this statement because I think it's said really well. The American Society of Plastic Surgeons president, Stephen Williams, looked and said, while the data suggests that the drastic growth of plastic surgery during the immediate post-pandemic period has stabilized, the demand for aesthetic procedures remains comparatively robust. As patients increasingly prioritize their aesthetic health, it remains imperative, this is what's important, that they also prioritize education and safety by seeking out board-certified plastic surgeons. This becomes even more important as patients increasingly try to differentiate quality care and truth among the messages they receive in social media and paid advertisements.
Yep.
John and I were just sitting here talking about, why is there such a big uptick in certain procedures? And, I came up with the fact that I thought it was a lot of these GLT agonists, Ozempic, Mounjaro, making people lose weight, so you have to cut out skin. And John turned around and looked at me and said, no, I think it's more social media.
And
this statement's amazing, right? I mean, this statement is what people should really, if you're going to take one thing away from this podcast, is just because you can do it, it doesn't mean you have to with someone. Make sure you vet the person you're going to because we see some disasters of finding your surgeon just on social media.
Yep.
So let's get into this.
All right. Drum roll number 2, breast augmentation.
Interesting.
As expected.
But it's up by 2%. I would tell you that I would think it would be down.
Because of the whole breast implant illness,
explantation, people out there, fear-mongering like, oh my God, you have toxic mold growing in your breasts. And guys, hear me out. Breast implants have been around for a while. We've been using them for breast cancer reconstruction. And the people that have breast cancer love the fact that they have breast implants because you're giving them that sense of the femininity back. Is breast implant illness real? For some people it is. But if it was really a big thing, well, this number would be significantly down. People are still getting them. People are still very happy. I rarely have a patient that's unhappy with their breast augmentation.
Yeah. All right. Number 3, tummy tuck, abdominoplasty. It's up 5% from 2022. And again, these are major invasive procedures, right? And we still see that incline, that increase in the number of procedures.
And there's inflation. So people aren't really spending money. But guess what? I think it's a combination of wanting to look good, self-care, and also maybe the weight loss drugs have something to do with it.
Sure. Excess skin, and now 170,000 people underwent tummy tucks.
Absolutely.
4, breast lift up 7%.
It's a lot. And again, this could be the same thing. Ozempic breast, where you lose a lot of weight fast, and then all of a sudden you're left with just deflated breasts.
Yep.
And really the only way to fix that is with a breast lift, because you have to remove skin and bring the breast up. Excellent procedure, high satisfaction rate, and it looks like exactly it's been up almost 7%. It's a lot.
And number 5, eyelid surgery, blepharoplasty. So over 120,000 procedures, and it's up 5% from
And they're all done in Beverly Hills.
Yeah. So top 5, liposuction, breast augmentation, abdominoplasty, breast lift, and eyelid surgery.
So those are your surgical procedures, right? And now with those, let's switch over and talk about the non-invasive procedures.
Sure.
Which had even a bigger uptick, right, than last year, which was 7% rise in minimally invasive procedures compared to the previous year.
Wow. And look, if we look at neuromodular injections, so that's Botox, essentially any of the Botox alternatives, Dysport, Xeomin, Jeuveau, and Daxxify, up 9%. So 9.48 million procedures in 2020.
And that's only what's documented. So I would probably say it's even more than that.
Sure.
But, I will continue to say this. And if there's one procedure that you can do, I would say, or non-invasive, it'd be Botox.
Sure.
Because you're really slowing the progression of aging. And I think people are getting it at a younger and younger age, and they continue to do it up into their, mid 80s.
The next is hyaluronic acid fillers with 5.3 million. That's up 8%. Listen, these are significant jumps. I mean, when you go up almost 10%, that's a significant jump from the year before, especially looking at the current state of the economy. And so as a little side note, it's interesting that people will not give up self-care. They will give up other things, but they won't give up self-care. Number 3, skin resurfacing. That is in the form of dermabrasion, chemical peels, lasers. That's up 5% from the year before. Number 4, any other type of skin treatment. That means laser hair removal, intense pulse light, IPL, laser tattoo removal, or laser treatment of leg veins. That's up 6%. Year before.
It's unbelievable. And then you have, lip augmentation, which is still up. So in a way, I'd look at that and say, maybe that was going to take a little dip because people are doing more lip lifts, even though I'm not a huge fan of them. It's still up. So, I think that it's good that people are still taking care of themselves. All the numbers have gone up. And then, you've got the reconstructive procedures, from hand surgery to tumor removal to breast reconstruction to maxillofacial surgery or even scar revisions. And all of them are up between 1% and 2%, even up to 4% for breast recon, which is bad but good in the sense that it may mean that more cancers are being diagnosed, or it may mean that more people are being treated, which is great. People that were unable to be treated.
I thought it was interesting. Minimally invasive procedures are up overall 7%. And so that's 2% over the surgical procedures. And so I think with newer technologies and that emerge, that's always going to be the case. It'll always rise a little higher than the surgical procedure.
And it's the gateway in a lot of ways. People do it, and then next thing you know, they say, okay, I've reached my limit and I can't put any more filler. I can't have any more skin tightening. And now I need some sort of surgical correction.
What I did find interesting is that the age ranges are shifting for the neuromodulators. And so when we look at the Jeuveaus and Botox, while ages 40 to 54 accounted for over 56% of all the injections, age groups 20 to 29 and 30 to 39 both saw more than an 8% increase.
Absolutely.
So people are starting these therapies younger. And I love Jeuveau. I've always said that. I'm a big fan of Jeuveau, and I'm not paid by the company or anything like that. But I just find that for me, it's a better neuromodulator. But their new campaign with a lot of things is, this is not your mom's Botox. Or
right.
This, and so
it's true. It's much softer.
Yes.
You don't feel frozen. You feel it looks very natural, but it still halts the progression of aging.
Yep.
Now, let's move on to something that I found to be very fascinating. And it's really up your wheelhouse, I should say. Patients looking to enhance their opinions really kind of, in my opinion, will most likely treat what they look at the most.
Yep.
And you brought this up earlier, how social media or even selfies make a big difference. Facial rejuvenation, facelifts have increased by 8% over the year. That's a big number.
It's a big number. It's very interesting to me. And I see why. And social media has helped with that because they're now showing that you can get some natural results and that people are starting to do them a little younger because they want it to last longer. And, the main thing is that you can get some natural, long-lasting results. You would think that these surgical procedures like this would decrease slightly only because of newer technologies, but that is not the case.
See, I think it's also part of this Ozempic face phenomenon. I'm talking, and again, we see a lot of more of it in LA than anywhere else because it's Hollywood and it's Beverly Hills and everyone will do anything to look their best and feel their best. So I think that once they've lost their volume in their face and their face starts sagging, you can put a bunch of hyaluronic acid in, and that's why those numbers are up too. But I think you eventually have to do a facelift to recontour someone's face if they've lost everything. Problem with that massive weight loss in a short amount of time is the elastin and the collagen are gone too. So you kind of want to make it heal really nice and pull really nice, but you're stuck. So I do think this is one of the reasons. And I think you've seen it too. Don't you think you've done more facelifts this year than last year?
Yeah, there's definitely an increase. I mean, listen, you can always attribute...
I should say last year than the year before.
Yeah, I mean, listen, you can always attribute it to the fact that with each year of experience, you start doing more and more and more. But I have seen a significant rise over the last year because people are starting to see that you've got some natural results, and that we can attribute to social media. I mean,
absolutely.
Other facial procedures such as eyelid surgery and nose reshaping continue to be increasingly sought after with a 5% and 6% increase respectively. So even rhinoplasty with a 6% increase, I think, again, I will stick to it. I think more people are seeing the potential.
I agree.
And they're being educated on these procedures. So you've got surgeons that are saying, here are my top 5 things, or this is what to expect, or these are the questions to ask your surgeon. So people feel more confident that they're coming into the consultation. They feel more confident with that person's work because they've already vetted them. They've already looked at their before and afters. And then they know how to care for it afterwards. I mean, so I have patients that are asking me, hey, should I be doing this, this, and this after procedures? It's very interesting to me because before people just say, hey, what do I do?
There's a lot of information out there.
Definitely.
And I think it leads to this. Now, I read this kind of take on what's causing it, and this ballet body is the new craze. So I think, and I see this myself where people are coming in to see me and they're like, I want you to make my breasts lifted and as small as possible. And I keep hearing this. And this is a much newer trend. They want that European, very skinny, wear a tight evening gown, but with no cleavage. It's changed because it was never really like that. Everyone wanted a little bit of volume. Their curves are kind of out now. If they do liposuction, they don't want to be hippie anymore. They want to be straight, kind of like ballerina. And that's the new craze. And it's interesting because... Yeah,
I think you can say more elegantly contoured.
Sure.
Where it's people... About 5-10 years ago, people were looking for these dramatic curves, so large breasts, tiny waist, large hips. And I see the trend away from that as well.
And one thing we didn't talk about is the explantation and breast implant removal. And that kind of goes in the same conversation as this ballerina body. People are removing their implants, and it's gone up almost by 10%. So 9%. It's a pretty big number. But what is it attributed to? Is it because of breast implant illness? Or is it because they just want to be smaller? Or is it because they're removing and putting new ones in? Or is it because they're removing it and putting fat in? So there are a lot of different options. And what I'm noticing is my older patients, they're like, listen, I'm 65. I don't know if I can have another surgery. Let's take my implants out. Let's put some fat in. Let's do a little lift. Whereas the younger patients are very scared to take their implants out. They may remove and replace and go smaller, which I've noticed a lot lately as well. But it is something that I've been seeing a lot of lately. And then obviously breast reductions, 7% growth. between 40 and 54, and then between 20 and 29, there's a 10% increase.
Yep.
And I've always said this, I'll say it again, the number one most satisfied procedure that we do as plastic surgeons is breast reduction surgery. It's a 2-for-1 special. You get beautiful breasts, but you also take away the pain, discomfort in your neck, back, and shoulders. And that's why that has gone up as well.
Surgical and non-invasive treatments combined for kind of a we'll say, quote unquote, holistic approach, because, and I've noticed in our practice over the last year, there's a lot more combination surgery.
Oh, yeah.
Right. And so it is where we are doing, let's say now the Mommy Makeover, plus you're applying laser or Morpheus or something like that to help tighten the skin. So it is kind of this marriage of surgical and non-surgical procedures together to try to help improve your results.
It's because we have it, so let's use it. Like you said, like we'll bring someone and do a tummy tuck and a breast lift, and they want their arms to be tighter. Well, to do that as well and put a scar on the arms is too much, so why not Morpheus them? Why not use some of the modalities that we have in the operating room, not just outside the operating room? Nice thing for us is, a lot of these trends kind of feed into our practice. A lot of these trends kind of feed into our style as plastic surgeons, which is kind of the ballerina body. We're not big into making very large breast implants or big BBLs or creating a very fake appearance of the face. Everything is very subtle and natural. And for us, all of these numbers and the statistics kind of really are a reflection of our practice in itself.
Yeah,
which is kind of a good thing. Can't wait to see what happens next year.
Yeah, exactly. It's so interesting to see because there's a slow, gradual progression of procedures that are increased. I haven't seen a drop in a few years in some of these things. Breast augmentation is always like 2%. 2%. Right. But when we see things that are closer to 10%, like breast reductions, and I think even 6% for rhinoplasty. And when you look at facelifting, it's interesting to me. You would think that I'll go back to the fact that as technology progresses, you'd think people would shy away from these and look for alternatives. And I think this last year, people are saying, no, look, give me something that's going to last long, that I'm not going to dump, money over and over and over and over. Give me the one procedure that's going to last for 10 years. And there's something to be said about that.
And that's why for many years, we've always said, go to an injector that can also do the surgery, right? Again, it's neither one of our favorite things to do, to inject the face with Botox or filler. We've been doing it for 15 years. It's something that we can do and we're proficient at. But it's nice because if you don't think it's the right idea, you can always cut the cord, draw the line and say, hey, instead of doing this, instead of me doing a non-surgical rhinoplasty for you every couple of years, why don't you just let me do the rhinoplasty?
Yeah.
And you're done.
The other thing about that is, make sure the practice has someone who's capable of doing that. You have the option. Like we have Natalie. Natalie's an amazing injector. She's our registered nurse. And the good part is, we've taught her at the point where you look for certain signs, and when you reach those, you say, look, I'm at the end point of what we're trying to do here before it starts looking strange. And that's when we start discussing surgery.
I think what we should do is next year we should compare our statistics to the ASPS statistics and see if facelift surgery went up for you, for example, as much as it did for the rest of the country.
Sure.
And kind of compare those. I think that'll be a fun thing to do.
Yeah, definitely. We gave you the top 5s to both the invasive and non-invasive procedures. We've kind of given our take on why we think this is happening. I think that social media is definitely boosting these percentages, and you're only going to see an increase, I believe, in the future because there are more educational platforms. There are more and more people who have adopted these platforms, and this has now been one of the main ways that people search for a provider. And it was interesting because years ago we were so concerned about a website. Then it became you were so concerned about a website on your mobile phone. Now it's, you want to make sure that your Instagram page is buttoned up tightly, because that's where people are going for it. And so it's rapid knowledge. Again, no one has that, attention span for longer than 30 seconds or a minute. And so now we're shooting out all these videos, trying to capture people's attention within a short period of time. And so far it seems to be working.
If you like this video, you're going to love this one. Those 5 procedures, they really popped. And I think, this is my take on this, and I could be wrong. I think people did so much facial surgery during the pandemic because they could hide out.